Good afternoon. I'm Mark Breslar, CEO at United Way, Greater Victoria. Thank you very much for joining us today for our second Local Love Virtual Cafe. As I mentioned during our first Virtual Love Cafe a few weeks ago, United Way is about community. And whether virtual or in person, we are grateful for the opportunity to meet anytime. Before we get started, a few housekeeping items. You'll have noticed you've been muted and your camera's turned off, but you can still communicate with us. If you have a question or comment, please use the chat function. Your feedback is very important to us, and our team will forward your questions to Gregor to include in this program. Should any questions not be addressed within the hour, we will commit to get back to you directly. Our attention continues to be focused squarely on the COVID-19 pandemic and the needs of the Greater Victoria community. And today we felt it especially important to bring attention to the needs of seniors during this critical time. This week is Seniors Week right across British Columbia. United Way has long supported a compassionate network of services that respond to seniors in need. The COVID-19 crisis has created an increased demand for social services for an already fragile system. Our virtual cafes have been created to bring together thought leaders to help us identify gaps, be more innovative in finding solutions, and to ask the question, how can we do better? What are some of the opportunities we could leverage now and as we forge ahead in this very uncertain future? So please join me in welcoming my fellow panelist, Isabel Mckenzie, Seniors Advocate for British Columbia. Isabel has been the voice, mind, and heart behind advocating for our seniors since being appointed Seniors Advocate in 2014. Isabel's experience working with seniors is long and deep, having worked in home care, licensed care, community services, and volunteer services. In fact, she led BC's largest not-for-profit agency, serving over 6,000 seniors annually. It was during this time, Isabel led the implementation of a new model of dementia care that has become a national best practice, and she has led the first safety accreditation for home care workers. Isabel has been widely recognized for her work and was named BC CEO of the Year for the not-for-profit sector and nominated as a provincial healthcare hero. Thank you so much for joining us, Isabel. I couldn't think of a better person to be here with us for Seniors Week on this very critical topic.
Thank you, Mark. Pleasure to be here.
And to ensure we make the very most of our short time together, I'm also pleased to welcome back CBC's Gregor Craigie as our moderator. Gregor did a phenomenal job at our first cafe, and we couldn't help but invite him right back. So thanks for joining us. Many of you listen to Gregor every morning as host of CBC's On the Island, and his career as a journalist is very impressive, including stints at the BBC. Gregor, thank you so much again for joining us, and I'm going to turn it to you to help frame healthy dialogue today.
Mark, thank you. Thanks for having me. It's a pleasure to be back. The United Way does so many great things for our community, and it's just example. So I'm happy to take part. And Isabel, thank you for joining us. I know you're incredibly busy these days, so thanks for taking the time out for this event. And to our listeners who are people taking part who are normally radio listeners, I'm sorry you have to see that I haven't had a haircut in about 3 months at this point. That's the beauty. Look at the radio voices. But anyway, we're going to move on to this discussion, which is a lot more important than haircuts. What a time it's been. And Isabel, I wonder if I can start with you just before we get to the specifics of COVID-19 and the pandemic and all of the issues around it. For the probably small number of people who don't know, what is your job? What is the Seniors Advocate of BC, briefly, for those who don't know?
Well, in summary, it's a statutory office of government that was created to provide oversight for senior services. So we monitor the services that are provided for seniors. We report to the public on how we're doing in those areas. We look at systemic issues that impact seniors and their families. We provide public reports, as you know, and recommendations to whether it's the provincial government or health authorities or local governments on what they can do to improve things for seniors. And we do operate information and referral. We have a fairly active 1-800 number and website as well.
Mark, what about the United Way? Seniors have long been a focus for the United Way, certainly for many years, and we know they're incredibly vulnerable right now because of COVID-19, seniors especially. So how do you see the United Way stepping up to support right now?
Well, we've been very active, Gregor, in a number of areas over the course of time, supporting agencies, whether it is the Island Deaf and Hard of Hearing to support seniors over the recent past. But critically, during the COVID pandemic, two critical areas come to mind. And one is a coordinated meals program for seniors. And through some seed funding through the federal government's New Horizons for Seniors program, we've been scaling the nutritious food offerings that we can bring to seniors throughout Greater Victoria. So it's a very impressive program. We've been working with Beacon Community Services, and they're serving as a hub. Some 14 agencies are involved, so we're playing a very critical convening and coordinating role. And with that, providing social interaction and meals to seniors. So we've scaled that up to about 1,000 per week, which is pretty impressive. We know the demand is there, and then more. So that's one great initiative we're very proud to be behind. The other one that has been a little harder to convene is a seniors table that we brought together, and I think that really demonstrates the art and science of United Way, and one of the things we do exceptionally well, and that is to see the need, convene a group, in this case, thought leaders, a combination of government, academia, seniors, caregivers, and really work through ideas. And we've put that table together 2 years ago. Frankly, it hasn't met very frequently, even virtually, during this pandemic, as we've been very much in response mode. But we'll resurrect it. It's been in place, and it brings tremendous ideas to us.
Thanks for those examples, Mark. Isabel, you were quoted as saying this week, "This pandemic has shown us that we really do care very deeply about our elderly." Why do you think it perhaps took a global pandemic for some of us to realize how vulnerable our seniors are within our communities?
Well, I'm not sure, Gregor. I think it could be no more complicated than you don't really appreciate what you have until it's under threat. And I think that that's what COVID has done, has put our seniors under threat because of the virulence of the virus amongst the older population. And I think it maybe overall has given us an opportunity to just reflect on what really matters in life, and relationships, and particularly those we have with the older people in our lives, matter quite a bit. And so I think those factors have combined, and we have mobilized to a stunning degree to support the seniors in our community now, and also to make a commitment for the future. And as we look at some of the issues that our more frail and vulnerable seniors are experiencing, we're trying to hold it together right now, but we also recognize we need to do better in the future. And you have to believe that the degree of commitment that's being made by all levels of government across the country, that we are going to see those commitments honored in the future years as COVID recedes.
What do you think are the primary needs for improvement, either in the short term or once this pandemic has passed? What's really been identified as perhaps needing more focus afterwards?
Well, I think in the community, if we look at where most seniors are, which is living independently in the community, I think what has been underappreciated has been poverty amongst seniors, the impact of that poverty. And I think it's underappreciated because it's not as visible as some other forms of poverty. and that on a day-to-day basis, seniors, low-income seniors can maybe hold it together a little bit with some duct tape. But when the pandemic hit and when the senior centers closed with their lunches daily or weekly, and the food banks were not open for a while, and the libraries where they got their free internet is closed, then I think the fault lines really did start to appear around the vulnerability of this group of folks, who we don't necessarily coalesce around as a low-income group, but it's about a third of our seniors who are on the guaranteed income supplement. So their incomes are less than a full-time minimum wage job would give you. So I think that is one of the things that has revealed itself. And then I think with our frail seniors, the ones who live in long-term care, I think it has certainly revealed the fault lines that have been there for a while. And again, it's similar to the story in the community. On a day-to-day basis, you don't necessarily notice the impact of certain things, but you notice it when a crisis hits, like we've seen with COVID. And these fault lines reveal themselves in very stark ways. And I think that that has startled, frankly, a lot of people, a lot of Canadians and a lot of British Columbians.
Mark, what about working with your partners? I wonder what opportunities you see to change the way that seniors have been supported in the past in this community.
Well, a couple of topics. Certainly, ageism is a reality, and whether one's in the workforce, it comes up. Arguably, for some, we hear about once you hit 50. So let's talk about seniors more in the conventional definition of age of over 60, 65. One size doesn't fit all. So I think really what we've learned at the seniors table, further, we haven't learned, but what's very topical is how to find different ways to individualize as well as we can, while at the same time efficiently responding. So to say someone's 90 or 80 and this is always the way it is may sound kind of obvious, but programs tend to be developed around that. So we're trying to build in those nuances and work with agencies that respond to that. That'd be one. I think the whole caregiver, the impact on the caregiver is especially topical. Personally, I can relate. I have two aging parents in Calgary. My wife's are in Toronto. So there's a myriad of issues, medically speaking, through the pandemic. This has been exacerbated by the inability to get food. Both sets of parents happen to be in their own homes, but isolation is certainly, there've been more calls, there's more access, there's more worry. So the impact on the caregiver, I think, is a really key point in this equation. We talk with the greatest respect for the frontline workers, and these are part of that group, whether in personal care homes or assisting in any way they can. So many of them are family members, and what resources can we provide? It could be stress reduction, mental health programs, but it is some provision of the impact and the trade-offs that one makes in worrying, caring for seniors. So caregivers, really important.
You mentioned off the top, Mark, closer to the top, the coordinated meal program that you've launched. And we've had a number of, thanks to all of our participants, by the way, who are texting in your questions, and a number of people have already asked, how can I help? How can I donate specifically to that or in some other way?
Please visit us at uwgv.ca. Well, we launched this program with the federal government's funding to kick this off. And this enabled us to go from what was a level of 90 meals per week being delivered through this hub and spoke kind of arrangement. And we've scaled that to 1,000. To sustain that beyond several months, it is our intention to build on this program into the longer term. And we see this as a critically important need into the near and longer term future. So the ask, greatly appreciate the interest. We certainly have more information on this program. It's developing as we go, but beyond the 2-month horizon, we'll actually be seeking assistance via private donations, businesses, any which way to continue to sustain this program.
So uwgv.ca is the website to go if a company or an individual wants to make a donation or help in some other way.
Yes, thank you. Or please, through this, we can respond directly to individual interests as well by email.
And through the thing, we've had another question from one of our participants about public money. How's the federal supports that have been made available in various forms, both for individuals and also some of the emergency funds that United Way and the Victoria Foundation are administering? How are they helping right now or being put to
extraordinarily generous. So starting with New Horizons, that was a program that enabled a specific focus on seniors. And more recently, the Emergency Community Fund has been allocated to 3 parties: United Ways nationally, Foundations of Canada, so the Victoria Foundation, the United Way Greater Victoria, and the Red Cross of Canada. And significant funds, 350 million nationally, was allocated. We're very fortunate within Greater Victoria to have roughly 1.6 million available between the United Way Greater Victoria and the Victoria Foundation. So we are granting to various agencies, not specific to seniors, but to a myriad of those in need entities right across the region.
Isabel, you've been following this, as you mentioned, for some years now, and in very detailed reports. In your 2019 Monitoring Seniors report, it says Victoria's seniors population is generally healthy, but yet across the province, we've seen COVID-19 having a devastating effect on some of our seniors. Could that have been avoided, and how do you think we might improve on that in the future?
Well, I think British Columbia as a whole has actually done very well. Certainly when you compare us to other provinces such as Ontario and Quebec and other countries such as the European countries and our neighbors to the south. That's not to say that we couldn't learn from some of the things that we've done. I think that we actually have taken an approach of learning as we go, which I believe is why we've been slightly more successful, particularly around managing outbreaks in our long-term care homes, because we learned very early on. We had a benefit. At the beginning, you know, it looked like we were going to be the epicenter. Don't forget, we had the first care home outbreak. We had the first care home death. We didn't have the first case in Canada, but our numbers were building the fastest at the beginning. And so I think the nimbleness with which we responded and the evidence-based approach that we used in response to that so early on, I think is what has helped us weather this storm relatively better than others. I think that a large part of that is also simply the organization of healthcare in British Columbia with its 5 health authorities. We are much more centralized and coordinated than they are, for example, in Ontario and Quebec. And that was a big part of it. And of course, I think we all recognize that none of that would have mattered without the clinical leadership of our provincial health officer and the political leadership of our government, who to a large extent that leadership was in following the clinical leadership and allowing us to follow that. So I think those factors, I think where we need to examine, you know, what things might look like in the fall is around this tricky balance of life has to go on, and the kind of lockdown, although it was for the most part voluntary in British Columbia, we still did it, that we've been through in the last 2 months isn't sustainable for a year or 18 months. And so how are we, you know, the ebb and flow of how we're going to live with that will be interesting as we move forward. And one of the critical areas is being able to visit loved ones in long-term care in the hospitals, right? Where We can't cut it off forever. We're going to have to face the fact that the doors have to open just a little bit at some point, and we're all going to be very, very nervous when that happens. But that's an area where I think we're going to get some learnings from.
There's been so much concern about long-term care. And Isabel, here's a question from one of our participants. Has the establishment of better at-home programs taken any necessary funding away from long-term care homes? And has government committed to increasing funding for both?
The short answer is Peter has not robbed Paul here. I don't think the money has come from long-term care to put into Better at Home. Better at Home, and Mark may be able to speak in more depth, but certainly the government did give a very significant grant and $50 million early on to the Better at Home program, which is recognizing a response during COVID, but also a need ongoing post-COVID to increase those community supports for people to be able to live at home. So at the end of the day, that is where everybody wants to spend all of their days, if possible, is in their own home. And what are the supports that we need in order to allow them to do that for as long as possible. In terms of long-term care and the funding, I think that there has certainly been a recognition that there are issues in long-term care homes across the country. Certainly the stories out of Ontario and Quebec were horrific. And the CAF dispatches were very troubling. I think we need to remember that by definition, the CAF went into the care homes that were in trouble. That's why they were there. So we were not going to expect it to look good. We were expecting, I think those of us who understood what was happening, as horrifying as it was to read those dispatches, when the Army was sent in, we knew what they might possibly be finding, hoping that they wouldn't. The degree to which, we don't have it to that extent prolifically here in BC, but we do have challenges. I mean, not so many months ago, we sent in administrators to care homes here on the island, right? So, I mean, we can't deny it. We do have issues. And I think that there's a commitment to recognize that the public is saying not good enough. And one of the things, Gregor, that's interesting, when you look at the numbers, most of us actually are never going to see the inside of a nursing home. Most of us never have seen the inside of a nursing home. Most of us have no clue what really happens in there. And now that it's been, out there what's really happening, we're saying, that's not good enough. And as Canadians, we're not going to put up with that, and we need to change it. And once the public gets mobilized, political action follows, right? That's the way it works, is the government's the people. If enough of the people want the change happens. I think we just didn't have enough of the people really understanding. And now I think we do. And so I think we will see that change.
Thank you for that, Isabel. I just wanted to add on some clarity on Better at Homes. It is a program to assist non-medical needs of seniors in British Columbia, funded by the provincial government of BC and administered by United Ways of British Columbia.
Okay. What about home care, Mark? I wonder if, and you tell me if my presumption is wrong, because I've been presuming that long-term care is more a question for government and some of the providers rather than the United Way. But I wonder, if the United Way comes into to either home care or long-term care for that matter, or is that mostly a separate issue from where you stand?
Primarily a separate issue, Gregor, really around the supports that we talked about. And again, ideas that come through the agencies we work with in support, but no direct involvement in long-term care at the moment.
But the community care is where you're obviously playing a huge role. And I wonder about some of the partner organizations in Greater Victoria who help you provide community-based senior supports and so on. How important is the ongoing collaboration? And is any of it at risk right now because of all of this?
Well, very much so. So the network, through the COVID pandemic, there have been 8 agencies that we have funded through our local love funding thus far. and they cross a variety from the Alzheimer's Society of BC to Beacon Community Association to the Galliano Club, all playing very separate roles, but enriching, creating I think a sum that's greater than the part. So touching on various areas of support. So where I talked earlier to the food delivery program, which is mission critical, these are areas of support from contact to mental health, and to Isabel's point earlier around access to technology, where we can help scale that up. We've also worked on that front. Again, there was free access to the internet previously. That's a tough one. So how can we get hardware in the hands of some of the seniors? And the identification of seniors has been sometimes when they're not in a specific environment like a long-term care home, identification through High Neighbor, which is a program we've run, has been a very telling throughout. Sometimes within neighborhoods, we don't know who our neighbors are, that they're seniors. BC 211 is a text call help center that's helped identify seniors, and we're very proud to be associated and behind BC 211 as a service.
Isabel, I want to go back to another question from one of our participants. Gina mentions poverty, and you mentioned that, Isabel. What about mental health? Of course, seniors living in poverty can receive help when from service agencies that they might rely on. What about mental health support? Do they need practical support when it comes to that?
Well, that's a very good question, Gregor. And mental health amongst the seniors population is what I would call an area of growing research. It's one that interests me, and it interests me because one of the questions certainly that I have is, to what degree are we ascribing a cognitive decline simply because of the age of the person to actually something that is a mental health issue? And there is a big difference, because mental health conditions can be treated, and cognitive decline to a large extent can't be treated. There are supports and there are things we can do that we think help delay it. But to me, the fundamental difference is, where have we put somebody in a box because they present with certain symptoms, and due to their age, we just say, well, that's to be expected, cognitive decline, you're in your 80s, versus they'd be in a different box with those same symptoms if they were 40, because we would recognize them as mental health issues. Mm-hmm. Right? And we would provide those types of supports and those types of treatments. And so I think that when you're 85, you're no more immune to mental health issues than you are when you're 40. You can certainly develop mental health issues at any point in your life. You can have lived a full life with what you believe to be no mental health issues, and then you start to stumble in your 80s. And it's not the natural aging process. It's a mental health issue. It's a depression. It's an anxiety disorder. It's something that we can look at a bit differently if we think of it as mental health. The impact of this pandemic on the mental health of seniors, and I would argue the population at large, we really haven't seen the true effect yet, Gregor, right? It has not, in the totality of time. It's been actually slightly less than 3 months, and it will compound and build. So I think that the shoe has not yet dropped, actually, on the mental health impact of this pandemic. I think that will come as the consequences of the isolation and loneliness compound, and as the consequences of the financial burdens that many have experienced come to bear. And that full impact is still down the road a bit.
I think you both mentioned earlier the burden on caregivers. Mark, you related that personally. And I wonder, Isabel, do you think that there will be more caregivers given some of the concerns about long-term care? Will more people pull their loved ones, their elderly loved ones, out of long-term care for better or worse, because they're concerned about leaving them in the facilities during the pandemic.
They might, Gregor. We don't, choosing to care for somebody at home who requires the level of care that would see placement in a care home, that's a fairly high level of care and a fairly profound burden to bear. So we don't know. I think it's a lot of people in theory will think they can and would like to. When the practicalities of what that means start to present themselves, some people may realize it's overwhelming for them. What I am concerned about when we talk about caregivers, and we had a case in the office just the other day of a woman whose husband went to adult day program 3 times a week. That's not insignificant. 3 days a week, this woman got a complete break during the day of 8 hours while her husband went on the handy dart to the day adult daycare and then came home. She didn't have that relief for over 2 months.
Wow.
And as a consequence, guess what? She's at her wit's end. And guess what? About 6 nights ago, she called the ambulance. She couldn't handle him anymore. And guess what? He's now being placed in a care home. So I'm interested in looking at what are the unintended consequences and what have been the impacts of some of the measures we've taken to control the virus. And that's where, when we look at, are there things we could have done better? What are the things we did that maybe we didn't have to do quite so stringently in hindsight, where there was this other impact? So adult day programs would be an example. Respite, we would often send folks to a care home for a week or 2 weeks to live there while their family got, significant respite. That hasn't been happening. We don't know yet. We'll have to look back at the numbers, and we're going to be doing that. We're going to look at April, May, and June of 2020, and how does that look different from April, May, and June of 2019? And, we don't know what we'll find. But as we move forward, this impact on family caregivers, I think, like the other things I mentioned, I don't think there's still another shoe to drop on those, I think.
Mark, we're getting lots of questions and comments from participants. How is that kind of feedback in general guiding you at United Way and helping you be adaptable in such an uncertain time? You're innovating as you go along here. I wonder how you're doing that with community input.
Well, we're involved through our work with agencies and so many that we deal with over the course of time. Collaboration, intel are critically important to what we do. So these kinds of issues, this kind of forum helps inform where we prioritize. We have been very much in response mode, as most human beings have throughout the first stages of this pandemic. But this helped with the food program, for instance, this kind of information anticipating ahead. So our Local Love initiative really is going to help direct and actually narrow some of our focus as we go forward. And it'll be the support systems required in anticipation of mental health amongst seniors, mental health in return to work. So all of these things together, we can't do them all. Everyone's playing a role, and it's critically important we guard against duplication, stay in good touch with other funding agencies, whether it be government, the Red Cross, or the Victoria Foundation, with X amount of resources. So there are a lot of moving parts. We're not a huge team, but we have, while all of our focus is the Greater Victoria region, and that's where our funding goes, we're very fortunate that we have access to best practitioners across the United Ways nationally. And so we pick up on issues, we pick up on ideas. And again, much of it is about not being able to do it all. So what can we do very well with focus?
Isabel, you mentioned earlier the idea of that other shoe dropping, that's still to come. And Gina asked what you think organizations like United Way and their network of agency partners can do now to prepare for that other shoe dropping.
That's a good question. I mean, I think there's a tremendous amount of good work being done. And I think that certainly when we look at the virtual visits and the connections that are being made with seniors through the Safe Seniors Project, I think that is significant. And I've just been reflecting during the whole conversation we've been having here of just the total importance of the local community. Not only can governments not do it all, it's not the same as when you're, you feel the love from your neighbors and your community and the people around you. That is what is going to make seniors, and arguably all of us, feel more confident and more secure as we go through the rest of this pandemic. That we know we're not going to be left alone, that we're going to get the food we need. We're going to be able to make our rent payment somehow. We're going to have somebody to talk to. Because I think at the beginning of this, there was a lot of fear that those, along with toilet paper, would not be here for us if we, but we now know that the community mobilized, right? We care about each other and we care for each other. And what you realize when you are faced with something like this, and I spent a career in community care where we planned for disasters all the time, it is about the person next door. That's who at the end of the day, the ones we would plan for the most, Gregor, would be, actually we didn't do a lot of pandemic planning, if I was honest. We planned for earthquakes and we planned for snowstorms in home and community care, right? And how are people going to get to the people's homes in an earthquake and a snowstorm? It came down to the most simple thing. Make sure you know your neighbor's phone number. Make sure you know your neighbor's name. And because that's who, when the roads are closed, when the phone lines are down, when it's being able to go and knock on a door, know who's there, and look out for the vulnerable people. Look to your left, look to your right. And if everybody does that, and everybody says, I've got you, we're going to be okay.
I really can't add much to that, but yeah, I was going to follow on that same theme of don't underestimate the power of the friendly visit, of taking stock. And does that require funding or a mass, mass gathering, a think tank or anything like that? No, but it's pretty fundamental building blocks for everything going forward. And we believe in that thoroughly.
I want to thank everyone for taking the time to contribute questions and thoughts on this. And before we wrap it up, I want to ask each of our panelists for final thoughts. Isabel, Mckenzie, final thoughts to you on this. What would you like our participants to take away from this conversation?
Well, I think the importance of the community, and I think I spoke of that in my last remarks. And, when I look at all of the threat that has been there for seniors, I am heartened by the silver lining to it all, which has been the absolute outpouring of support. And the Safe Seniors Strong Communities program, where we said to BC, if you want to help seniors, call 211, and the phone lines crashed. So many people phoned in. And here we are. I think it's almost at the 100,000 mark for services delivered. And it really, the United Way movement, as I knew it when I was involved, basically embodies this community and this mobilizing of us as a community. And that's what we've done. And it's clear that that's what we needed to do. And so I think we will weather through this pandemic.
Thanks, Isabel. Mark, final comments from you?
Sure, thanks, Gregor. And thank you for that, Isabel, and for your longstanding commitment to United Way and all the good work you do. Very much appreciate it. Really, we are so delighted to be part of this meal delivery hub. and looking forward. So launch was one thing, mobilizing so quickly, and that will be a key focus for us going forward. Because it really extends beyond the basic nutritional value. There is social interaction, albeit with some physical distancing, but there's actually that touch point. So it really has this multiplier effect, but most importantly, it's food. And so that's a key point going forward. I talked about our seniors table and that planning work and bringing the parties together, and actually having seniors having a voice is pretty critical as well. It's like many other issues where certain people are speaking for others, and sometimes it's a good additional opinion, but it's always great to go to the source. So I think that's really key. But of that seniors table, we really need to ensure we're shifting into action on that front. And to the extent, I think this applies to all aspects of this pandemic being a new reality to everyone. And that is, to what extent can we document some of these lessons learned in these specific areas and build upon them? We've all been in response mode in everything we do as people since March, effectively on this continent. So what are some of the lessons learned? How do we build on that? And I think that is really what it's about. So our areas of focus, continuing with some new initiatives, and going forward, will be very much shaped by our community and its needs during and post-pandemic, whenever that may be.
Thank you, Mark, and thank you, Isabel, as well. Thank you for inviting me. This is another useful conversation and an important one at this time. Mark, thanks for having me along.
Gregor, thank you, and appreciate the questions. Gregor, Isabel, you've just been an immense help and a real pleasure to be part of this panel. I admit some trepidation coming in with the seniors advocate because I don't have this big storied background in seniors care, but thanks for being gentle on me, you both. But I hope everyone found it informative. Really appreciate Isabel and Gregor giving of your time as you have. Again, it came up as a question. Thank you for your interest. To our participants at the panel today, our audience. Again, we are looking to scale up our meals program, and happy to speak to it. The estimated quantum, and the whole idea of the webinar, I stated the objectives earlier, is not to fundraise, but there is a significant need in our community going forward. So we invite your interest and be happy to speak to you personally about it. We did record this webinar, and it will be posted on our website, and we'll share it on social media. For those of you that did enjoy this topic and have other topics to offer, please bring your ideas forward. We're planning a next Local Love virtual cafe, probably sometime in mid-July. The topic might well be mental health, and that's certainly what we're gearing to do right now, and a little bit of prep to happen there. I want to thank those on my team who were key in putting this program together, some behind the scenes managing the controls. And I really want to thank all of our supporters of United Way and all of our community partners. And for all of you who took time today to attend, we're most grateful for your interest. Always welcome your ideas and feedback. And I wish you all a wonderful afternoon, and stay safe. Thank you.
Thank you.
Thank you.
Thank you very much, Mark and Isabel and Gregor.
Thank you.
Thank you.